Hello there, are you okay? Thanks for joining me. My name is Dr. Rajiv. This is my education channel, YouTube Surgery and Orthopedic Education. In this session, we shall cover 10 important MCQs on the topic Basic Surgical Anatomy and Physiology for the preparation of MBBS, INI-CET, NEET PG, INI-SS, FMGE, DNB entrance and UPSC Combined Medical Services examinations. Each MCQ will be followed by a detailed description. You may prepare a note of important topics for future reference. A lot of important material will be delivered in this talk, so hang on till the end. The correct answer in question number 1 is option C. The pituitary gland or hypophysis lies in a pocket on the superior surface of the body of the sphenoid bone known as sella turcica. Its anterior lobe or adenohypophysis secretes thyroid stimulating hormone TSH, adenocorticotropic hormone ACTH, luteinizing hormone LH, follicular stimulating hormone FSH, prolactin and growth hormone GH. Thyroid stimulating hormone is the primary stimulus for thyroid hormone production by the thyroid gland. The hypothalamic pituitary axis regulates TSH release. Neurons in the hypothalamus release TRH or thyroid releasing hormone, which stimulates thyrotropes of the anterior pituitary to secrete TSH. TSH in turn stimulates thyroid follicular cells to release thyroid hormones in the form of T3 and T4. T3 is the active form of thyroid hormone. The T3 represents only 20% of the released hormone, whereas the majority of T3 comes from peripheral conversion of T4 to T3. The correct answer in question number 2 is option B. The glands of the stomach have three major types of cells, namely mucus cells which secrete mucus and bicarbonate ions, chief cells which secrete the proenzyme pepsinogen, and parietal or augmentic cells that secrete HCl and intrinsic factor. Mucus glands are present in the cardia and the pyloric region. The parietal cells and chief cells are present in the body of the stomach, including the fundus. Chief cells or peptic cells secrete proenzyme pepsinogen. The pepsinogen in the presence of hydrochloric acid gets converted into the active enzyme pepsin. The pepsin breaks down proteins into proteases and peptones. Gastrin is mainly secreted by G cells, which are neuroendocrine cells in the pyloric antrum of the stomach. It is also secreted by the duodenum and pancreas. Histamine in the stomach is synthesized by enterochromaffin-like cells or ECL cells. It stimulates histamine H2 receptors on the parietal cells, resulting in gastric acid secretion. The correct answer in question number 3 is option C. The recurrent laryngeal nerve is a branch of the vagus nerve. In the neck, both nerves pass close to the inferior thyroid artery. Near the thyroid gland, the recurrent laryngeal nerve may pass anterior or posterior to the inferior thyroid artery or between its branches. It is the motor nerve to all the intrinsic muscles of the larynx except cricothyroid, which is supplied by the external laryngeal nerve. It is also a sensory nerve for the mucous membrane of the larynx below the vocal cords. There are two recurrent laryngeal nerves. The right recurrent laryngeal nerve loops under the right subclavian artery, while the left recurrent laryngeal nerve loops under the aortic arch. The relationship between the recurrent laryngeal nerve and the thyroid gland is very important to a thyroid surgeon. The nerve enters the larynx at the cricothyroid joint, posterior to the thyroid at the level of the Berry's ligament. At this point, the nerve is at most risk of injury during a thyroid surgery. The recurrent laryngeal nerve injury results in vocal cord paresis or paralysis. Careful intraoperative identification and preservation of the nerve is mandatory to minimize the risk of injury. During operation, the nerve is found when the thyroid lobe is mobilized laterally, lying under the tubercle of Zuckerkund. The correct answer in question number 4 is option B. There is an extensive lymphatic network within and around the thyroid gland. Few lymphatics pass directly to the deep cervical nodes. However, initially major lymphatic drainage goes to the periglandular nodes such as prelaryngeal or Delphian nodes, pretracheal nodes and paratracheal nodes, and then to the deep cervical and mediastinal nodes. The correct option in question number 5 is option D. Nerves supplying the larynx are the superior and recurrent laryngeal nerves. Embryologically, the superior laryngeal nerve is derived from the fourth branchial arch and the recurrent laryngeal nerve from sixth arch. The superior laryngeal nerve arises from the inferior ganglion of the vagus nerve. The superior laryngeal nerve divides into a smaller external laryngeal nerve and a larger internal laryngeal nerve at the level of the greater horn of hyoid bone. The external branch of the superior laryngeal nerve innervates the cricothyroid muscle, which is the only tensor of the vocal cords. Injury to the external branch of the superior laryngeal nerve is more common because it lies very close to the superior thyroid artery. The external branch of the superior laryngeal nerve crosses the superior thyroid vessels near the upper pole of thyroid gland. Injury to the external branch of the superior laryngeal nerve is more common than that of recurrent laryngeal nerve during thyroid operations. Injury to this nerve results in diminished power and range in the voice, that is, an inability to create a high-pitched sound. This may threaten the career of singers or actors who rely on their voice for their income. Speech therapy is the only treatment. The correct option in question number 6 is option B, that is ventral horn of C4. Each lung can be divided into four main parts: apex, base, root, and hilum. The given picture in question is a cadaveric specimen of the left lung because its conical end or apex is directed upwards and its lower end or base is directed downwards. Its convex or costal surface is directed laterally and its flat medial surface showing the hilum is directed medially, as well as its sharp margin faces anteriorly and its rounded posterior border faces posteriorly. The side of the lung is not determined by number of fissures or lobes because they are variable. The point A in the picture lies anterior to the hilum. Hence, its position corresponds to the course of the phrenic nerve because in the mediastinum, the phrenic nerve runs anterior to the root and the hilum of the lungs, whereas the vagus nerve runs posterior to these structures. Because the root value of the phrenic nerve is C345 and the bulk of the phrenic nerve is formed by the root C4, the answer to this question is option B. The intermediate or lateral horn fibers in option A provide autonomic supply to the abdominal and pelvic viscera. The medulla oblongata is divided into two parts, open and closed. The open part is the upper part of medulla where the fourth ventricle lies, and the closed part is the lower part that surrounds the central canal. You can see that the option C is totally unrelated to the lung. Dorsal nerve roots carry sensory neural signals to the central nervous system from the peripheral nervous system. Dorsal root ganglia emerges from the dorsal root of the spinal nerves. They carry sensory input for touch, pain and temperature from the periphery towards the central nervous system for a motor response. Thus, option D is excluded. The correct answer in question number 7 is option E. In this question, the examiner wants to evaluate the student's knowledge of the emergency airway management of laryngeal edema after a severe allergic acute anaphylactic reaction. Symptoms of laryngeal edema are hoarseness, changes in the voice, pain or discomfort in the throat, difficulty swallowing, shortness of breath, and, if severe, unconsciousness. And in this patient, most of these symptoms were present. The emergency cricothyrotomy is the last step in the emergency airway management algorithm. This intervention becomes necessary when you find yourself in a SICO scenario, that is, in a cannot intubate, cannot oxygenate situation. An emergency cricothyrotomy is indicated when you cannot secure a patient's airway through non-surgical methods or when other devices such as laryngeal mask airway, fiber optic laryngoscope have failed or are unavailable. Some situations in which a physician needs to do emergency cricothyroidotomy are oral or maxillofacial trauma, cervical spine trauma, profuse oral hemorrhage, allergic angioedema, copious vomiting, and anatomic abnormalities that prevent endotracheal intubation. The incision of cricothyrotomy first divides the skin, then the superficial and deep cervical fascia, and finally divides the cricothyroid membrane between the thyroid and the cricoid cartilage. As soon as possible, the cricothyrotomy should be converted to a tracheostomy. It is very easy to select the correct answer because cricothyroid membrane is there in only one option, that is E. Hence, the option E is the correct choice. The correct answer in question number 8 is option D. The porta hepatis or liver hilum or transverse fissure of the liver is the gateway to the liver for entry or exit of various structures that supply and drain the liver. It is a deep fissure on the inferior surface of the liver and lies between the quadrate and caudate lobes. The structures of the portal triad, namely hepatic artery, portal vein, and right and left bile ducts, along with nerve and lymphatics, enter the liver at the porta hepatis, but not hepatic veins. The portal triad runs within the hepatoduodenal ligament or the free edge of the lesser omentum. The three hepatic veins, right, middle, and left, are intrahepatic. These drain into the inferior vena cava on the posterior surface of the liver. These do not emerge through the porta hepatis. The correct answer in question number 9 is option B. The liver receives blood supply from two sources. The oxygenated blood is supplied by the hepatic artery and the blood rich in nutrients is supplied by the portal vein. About 80% blood is received from the portal vein and 20% from the hepatic artery. The portal vein is formed by the joining of the superior mesenteric vein and the splenic vein behind the neck of the pancreas at the level of L2 vertebral body. The correct answer in question number 10 is option E. Metastatic lung cancer is an advanced disease. Clinical features of lung carcinoma depend on the site of the primary lesion, the involvement of neighboring structures, and the site of metastasis. The jugular foramen syndrome, also known as Wernicke syndrome, refers to paralysis of the ninth, 10th, and 11th cranial nerves after traumatic, inflammatory, vascular, or metastatic lesions of the jugular foramen. There are two jugular foramina in the skull base, located on either side anterolateral to the foramen magnum. The nerves that pass through this foramen are glossopharyngeal, vagus, and accessory nerves. Clinical features depend on the structures compressed at one or both foramina. The involvement of the glossopharyngeal nerve leads to loss of the ipsilateral gag reflex. Its unilateral paralysis leads to deviation of the uvula to the normal side on saying ah. Vagal compression causes hoarseness and dysphagia. Accessory nerve compression leads to drooping of the shoulder, difficulties in abducting the ipsilateral arm, and rotating the head contralaterally due to weakness of sternocleidomastoid and trapezius muscles. From the above discussion, it is clear that the clinical features in this patient are due to metastatic deposits compressing the nerves passing through the left jugular foramen.